David Jackson, Unit 4 Project Fire Administration. Speaking about criteria-based dispatching. One of the most important agenda items that needs to be emphasized to this community in the town hall meeting is to understand the purpose of criteria-based dispatching, which we also call in the field priority dispatching. The purpose of priority dispatching is to provide all medical and emergency fire dispatchers with the understanding of Medical Priority Dispatching System, MPDS, and Fire Priority Dispatching System, FPDS, with their respective protocols to use as it relates to a safe and effective provision of emergency services. The services will include the interrogation of the callers, sending the appropriate response, providing telephone assistance, and disseminating necessary information to responding emergency units. In addition, there'll also be a compliance protocol which shall be ensured through the quality improvement processes. Dispatch process. So Medical Priority Dispatch System and Fire Priority Dispatch System will provide a standard interrogation process, post-dispatch and pre-arrival instructions, as well as dispatch to determine configurations. In layman's terms, the dispatcher will be given the 911 caller information and asking them specific questions to determine the appropriate unit to respond to their call of service. For example, if a person is calling because they jammed their toe and they want to go to the hospital, the Washington Fire Department will not send an advanced life support engine and instead send a basic life support ambulance, no lights and no sirens due to the nature of the call. Both the MPDS and FPDS systems will have a backup card set along with the ProQA software that shall be provided at each call answering point and dispatch position. The card sets shall always be kept at the console even if the ProQA software is in use to serve as backup in case of a computer outage. Interrogation. The emergency medical dispatcher shall always ask the following questions of callers requesting medical help. What is the address of your emergency? What is the number from which you're calling from? Tell me exactly what happened. Are you with the patient? How old is the patient, or what's their approximate age? And are they conscious and breathing? For the fire dispatch, they're going to always ask these sets of questions when requesting help on fire-related situations. What is the address of your emergency? What is the number from which you're calling? Are you at the location now? And do you see any smoke or flames, which is a fire-related emergency? Pre-arrival instructions. So pre-arrival instructions shall be provided directly from the scripted text list on each protocol script. While giving these instructions, the dispatcher will avoid freelancing or any type of freelance information unless it enhances the call but does not replace the routing protocol. This section is important to ensure that the right units are going to the right determinant of calls. The intended goals and objectives. The intended goals and objectives of criteria-based dispatch is to process the 911 calls and dispatch the appropriate units. Priority dispatching determines the appropriate response to each emergency and non-emergency 911 call. These emergency medical dispatchers are specifically trained and certified and will dispatch the units according to the national guidelines and local protocols. In many cases, more than one emergency vehicle, such as a fire engine or an ambulance, will respond to the same 911 emergency call. This is based on the location of both units as well as the severity of the call. If it is potentially a life-threatening situation, units will respond with their lights and sirens turned on. In a non-emergency situation, this type of response is not necessary and multiple emergency vehicles do not need to respond. In this case, one vehicle can manage a call safely and effectively. Critical areas of concern. So for the public, there might be a concern that there will be a mistake that either the improper emergency vehicle might not come to their emergency, or it might be felt that their emergency might be disregarded. In these events, it's important for the Fire and Emergency Services Administrator to be transparent and communicate how the system works as well as what is going to be continued as an emergency to fire service personnel. Desired outcomes. There are a few desired outcomes for the criteria-based dispatching. First, we want to be transparent and have them understand the benefit to them as a citizen of the community, as well as resource allocation within the fire department. It should be addressed specifically what calls for the fire department or EMS are considered to be emergent, and then what calls are considered to be non-emergent. An example of an emergent call could be a structure fire, cardiac or respiratory arrest, traumatic calls in nature, things like that. An example of non-emergent calls should be back pain, lift assist, smoke detector battery changes, or anything that does not require an immediate fire department or EMS response. The purpose of this is to save the potential emergency services for emergent calls so that an ALS units are not tied up on basic life support calls when an emergency comes out in the same area. This scenario would delay the response of the ALS unit to the critical call.